I'm Misty Robbins. I'm the spine coordinator here at Texoma Medical Center, and we're excited that you're going to have your spinal fusion surgery with us. For this class, we're going to go through everything that you need to know to have a successful surgery. As you go through the class, please write down any questions that you might have, and you can contact me. My number is at the bottom of the screen and will show throughout the presentation, and I will have my information posted at the end. We want to make sure you have a successful surgery here at Texoma Medical Center.
So the reason we do this class is really to help prepare you for your best functional outcome after surgery. I'm going to try to go through everything. I'm going to talk about why you have spine surgery, what you can do before surgery to get yourself ready, what you can expect when you're here with us in the hospital, and then what it looks like to go home and continue your care at home. As we go through this class together, please feel free to make notes, to write down any questions that you might have. At the end of the presentation, I will make sure that you have my information so that if you have any questions afterwards, you can reach out to me, because I want to make sure you come into the hospital ready to go, having all your questions answered, knowing exactly what to expect. And we want to thank you, of course, for choosing Texoma Medical Center. We know that you could have gone anywhere to have your surgery, but you chose to have it with us, and we do not take that lightly. As you can see, there are a whole lot of people who are involved in your care here. Of course, number one, most importantly, is going to be your surgeon, whether that's an orthopedic surgeon or one of our neurosurgeons, whichever one it is, we for sure are going to have them involved in the process. And then, of course, some others, maybe another doctor or the hospitalist, some nurses. Therapy is going to be a very important part of the process, and you will actually hear from our therapy team later in the class, letting you know kind of what to expect from them. We will have, of course, nursing assistants, therapy aides, respiratory therapies involved, and then we have people here, social workers and case managers, who can help make sure that you have everything that you need whenever you go home. All right, so why do you have spine surgery? Well, it is to ease different symptoms that probably sound familiar to you, including pain, numbness or tingling, muscle weakness, and instability. And this might treat different things that are causing these issues, like possibly narrowing around the nerves. In fact, that's the big culprit that we see most of the time. Could be a herniated disc or even previous fractures. So kind of looking in your body at what's going on. First off, whenever we look at and we talk about the backbone's made up of a whole lot of different separate bones. They're kind of separate here and they interlock here at the back, but they're all in different sections. So here around the neck, we call that the cervical spine. In the purple, these bones here, that's part of your thoracic spine. Those are the ones connected to the ribs. Here in the yellow is the lumbar spine. Down here green is the sacrum, and then you have the coccyx. Now, depending on what surgery you're having, most likely it's either going to be up here in the cervical spine or it's going to be focused here in the lumbar spine region. So between all of these bones, as you can see here, there are discs. The discs separate the bones and they provide a lot of cushioning, which makes movement a lot easier. Back here, like I said, this is where the joints are. This is where they're interconnected. And then one very important role of the backbone is to house the spinal cord. So the spinal cord connects up here to the brain and runs all the way down. And off the spinal cord, you can see this cord's hidden back there, nice and protected like it needs to be. And then off the spinal cord come these nerve roots. And these nerve roots run out from your spine and they run all the way down to different parts of your body. Now, if you're having issues up here with your neck and we're having a cervical fusion, you might have noticed that you have issues all the way down your arms, all the way down your hands. And then likewise down here with the lumbar spine, you might have noticed you're having issues all the way down to your legs and feet. That's because the nerve roots that come out in these different areas, they go to those different parts of your body. So you might be having that numbness and tingling all the way down, and that's why, because that nerve root coming out is being pinched off, and those signals are not able to travel like they're supposed to. I like this picture. It makes it really clear. This is the opening that we have that lets that nerve root come out. So you can see it's nice and wide. That nerve root can come out here, go where it needs to. Well, you might have some bone growth, a little extra bone growth here, maybe a little bit here, maybe some here. And you can tell how it doesn't take very long for that nice wide opening to start getting more and more and more narrow. And to the point where what was once an easy pathway for this nerve root is now pinched off, and that's interrupting the signals that go from your brain to the rest of your body to tell it what to do. So that means you might not have the same sensation that you used to. You might have that, you might have muscle weakness, or of course, you know, with the pinching off of the nerve, you might have that nerve pain. So when your surgeon goes in to do the fusion, the first thing, of course, he's going to make that opening a lot wider. So all of that narrowing from the different bone growth, he's going to clean that up, remove that bone growth that's not supposed to be there. He's also going to remove the disc in between the two bones that are being fused. If it's more than two, then we'll remove every disc between those bones that are being fused. He's going to end up replacing it with what they call a cage. This is an open cylinder that has about the same height as the disc, so it's going to keep that same height between the bones. And then he's going to put in this open part in the center, he's going to put a substance that encourages bone to grow. So we're going to get these bones encouraged to grow together. And he's actually going to save some of these pieces of bone and load that in there too. So this is like the perfect recipe to get these two bones, or more, of course, the bones to fuse together, which is what we want. For added stability, of course, while this process is happening, we have these rods and screws here, sometimes plates, that make everything nice and stable. So you can see the screws are going to go into the backbone. That's going to be checked for positioning before you're even sewn up. It's going to provide the stability as your body heals to regain, to ease the pain, to regain some of the movement that you lost. Sometimes with the fusion, your surgeon might talk to you about also doing a laminectomy at the same time. So with a laminectomy, you can see your surgeon will make an incision or even remove part of these spiny processes here on the back. That opens this pathway up for where your spinal cord is, and even some of the nerve roots in there too, and makes it where that part is not being pinched off either. So if your surgeon has talked to you about both of those, that's kind of what it's going to look like. He can do both at the same time. Now, when we're talking about your surgery, we encourage you to find a coach. A coach is the term we use for someone that you find in your life who's going to be helping you out through the process. Now, depending on your surgery and, of course, your surgeon, you might have certain restrictions that make the coach's job really important. They might have to do some of the heavy lifting, so to speak. Even if you don't have to have someone to do the heavy lifting and you don't have as many restrictions yourself, it is really important to have that person in your life who can encourage you through the process, kind of help you out as you're healing up from surgery. But it's really important to have someone identified in your life who can help you out through this process. In preparation for surgery, we recommend, of course, and this won't come as a surprise to anyone, we recommend that you stop smoking. Now, especially with surgery, we have found that smoking can increase your chance of getting a blood clot. It can increase your chance of getting an infection or having a complication. And it also means you take a lot longer to heal than you normally would. None of those things which we want with surgery. So our best recommendation is to stop smoking now and be non-smoking for at least 6 weeks after surgery. Keep in mind that if it's not you, but someone smoking in the home, secondhand smoke can be just as bad for you. So see if maybe they'll smoke outside for that same length of time. And then I have to mention too, if someone's listening to me and they're thinking, I've tried to quit a million times and I haven't been able to, you should know that every cigarette you don't smoke that day gives you a better chance at healing. So if you can't quit, but you can cut back, please don't think that is nothing. Cutting back also helps. You also want to be careful, especially after surgery, especially like the alcohol that you take in, that can have an interaction with some of the medications we're going to give you for pain. Alcohol, certain other substances. So for alcohol, you want to keep to no more than 2 drinks a day for men, no more than 1 drink a day for women, and make sure you're asking your surgeon about any other substances you're taking to see if they're going to cause an interaction. There are also certain medicines that they will have you stop taking. Usually these are something like a blood thinner. So like your NSAID medications, that's going to be like your ibuprofen, naproxen, Celebrex. Aspirin's also one they'll want you to stop. There's going to be certain vitamins and minerals they'll probably have you stop taking before surgery. And then if you are on a GLP-1 medication, that's going to be like Wegovy or Ozempic, they're going to have you hold that for a week just because it interferes with gastric emptying, and we don't want to have any risk for aspiration when you come in for surgery. Your diet before surgery, before and after surgery, I should say, is very important. Protein is going to be number 1. So Protein is the building blocks that your body uses for repair. So when it comes time for recovery after surgery, you want your body to have all the protein available in your system ready to use so that you have a smooth recovery process. Protein's going to be like your meats, chicken, beef, ham, turkey are all really good sources of protein. Eggs for breakfast in the morning, beans, fish. You want to make sure you've got lots of protein in your diet so your body has everything that it needs for a good recovery process. You also want to make sure you have plenty of fiber and water in your diet. So with fiber, that's going to be like your whole grains, your whole wheats. Fruits and vegetables tend to be a really good source of fiber. But after surgery, especially, we're going to be giving you some medicine that does tend to cause constipation. So lots of fiber in your diet and making sure that you stay nice and hydrated. Those are two things that will really help prevent or alleviate constipation. If you're diabetic, you also want to be monitoring your blood sugars. Ideally, we would love to see you running under 150 most of the time when you check your blood sugar, but at least under 200. If you find yourself every time you check your blood sugar, you are consistently over 200, that can end up making surgery dangerous, so you would want to let your surgeon know the numbers that you're seeing. In preparation for surgery, we're going to give you a packet to help optimize your nutrition. We've seen studies that show this can help decrease your chance of nausea and vomiting after surgery and help promote early healing. So in the packet that we're going to give you, you'll find two different things. The first one is this Ensure Immunonutrition Shake. Now, I know that Ensure is probably a name most people recognize. You can find Ensure brand products at Walmart. This one is the same brand, but it's a little bit different. It's made especially for people who are going through surgery. So it's got some protein in it, but it also has some other really good nutrients broken down really well so your body can use it easily around the surgical time. So you kind of 5 days before surgery, you'll start drinking it, giving your body everything it needs. Then you'll do it 5 days after surgery as well. So you've got all those good nutrients in that immediate post-op period. We want you to do 2 shakes a day, again, starting 5 days before surgery and doing 5 days after surgery. So you will notice in your packet that you only have 10. That's enough for before surgery. We will give you 10 more for after surgery when you come in. The other thing that you're going to find in your packet is your carb loading drink. So this is going to give your body a good boost of carbohydrates right before you go through surgery. This is really good for helping prevent nausea and vomiting, and it helps promote better glucose control after surgery as well. With this one, the first one you're going to have the night before surgery. You'll drink it anytime after dinner before bedtime. And the other one you're actually going to have the morning of surgery. Now, if you've already had your pre-assessment appointments, you probably remember them telling you not to have anything to eat or drink after midnight, which is true except for this. This one's the exception. Your surgeon knows you're drinking it. Your anesthesia team knows that you're drinking it. Your nurse knows, so no one's going to bat an eye if you drink this. Now, don't drink this, and wash down an egg sandwich, but as long as you only have this one, you should be fine. On your paper that you're given talking about this, it will tell you to drink this about 3 hours before surgery. I know this confuses a lot of people because we don't actually give you a surgery time, we get you an arrival time. So let me make things a little bit easier. We for sure want to make sure you have this 2 hours before surgery to give it plenty of time to work through your system. Normally, if you drink this before you leave for the hospital, before you get in your car to leave, that puts you at about 2 hours before surgery. So as long as you drink it that morning before you leave for the hospital, you should be fine. Now, all of these instructions that I have are for people who are not diabetic. If you are diabetic, these instructions are going to be a little bit different. So if you're diabetic, make sure you go ahead and give me a call and I will run through those instructions with you. Now, there's also some things that you can do to get your home ready for surgery. Okay, first off, we want to make sure when you go home, we're going to be working on preventing infection. You want to start off with a clean environment. So before you come in for surgery, give your home a good deep cleaning. Vacuum all the carpets, get out your antibacterial cleaner, spray down all your surfaces, get everything nice and clean, ready for you when you come home. We recommend having someone stay with you for the first few days just as you're healing up for surgery. Most of the things you should be able to do yourself depending on your restrictions, but it does help to have someone around. Look around your home for things you could trip over. You're not going to be going home on a walker or cane, most likely if you haven't already been using one of those. But of course, after surgery, your balance is probably going to be a little different, so we don't want anything in the way. Loose rugs are always a big culprit. If you've got any of those in your home, go ahead and pull them up. If you've got any cords or clutter in your paths, move that out of the way. Keep in mind that lots of people tend to keep those furry four-legged trip hazards in their home. So if you've got one of those, I'm not going to recommend you get rid of it, but you do want to make sure you keep that in mind whenever you go home, that pets underfoot could be a trip hazard. You want to make sure you've got good lighting in your home, especially at nighttime. When you're getting up out of bed, you don't want to have any instance where you have to take a couple of steps before you can turn on the light. You want a lamp that you can turn on before you get out of bed, night lights in different rooms, night lights through your hallways. You want clear, well-lit pathways. Now, depending on the surgery you're having, you might have some restrictions. Therapy team, they will come at the end, and they're going to talk about all the different restrictions you might have based on your surgery and what we're going to do to help you out while you're here. So again, if you have different restrictions, especially restrictions on how much you can lift and how much you can bend, you really want to think about your home setup before you come in. So I like to use this kitchen as an example. If we look at this kitchen, if you've got restrictions on bending and lifting, most likely anything here on the counter, here in the bottom part of the upper cabinets, or right here in the drawers, all of those things are things that you can reach for depending on the weight, of course. If there is anything way down here or way up here, that's something that will most likely be off limits for you for a little bit. So think about all those items in your home you reach for often. You want to make sure you get them around countertop height so it's something that you can grab. Okay, so think about what that means in your kitchen. You know, if you've got a favorite skillet that you use to cook in the morning, you don't want it way down here in the shelves because you're not going to be reaching for that. Think about in your fridge, you know, maybe you normally pack your waters down at the very bottom. You'll want to move those up so that you can grab them easier. Your room, you know, if maybe your underwear drawer happens to be the bottom drawer, you probably want to move those up because you don't want to have to call a coach every time you need to put on a new pair of underwear. Think about your bathroom, bedroom, just everywhere in your home. Think about those items you grab for often and put them within easy reach. You also might think about making some meals ahead of time and having them ready to go for after surgery. Something you can pop in the microwave and reheat really quickly, or maybe a casserole you can just put in the oven, especially if you're having restrictions and you might have a coach who's going to be out for part of the time during the day. You want food items that you can grab easily and have right there on hand. As far as the equipment that you're going to need, part of this depends on your surgeon's recommendations. We always recommend people, especially with those bending restrictions, think about a reacher. This is not something you are required to have, but this does help, especially if, you know, maybe you drop your phone and your coach is out, or you drop your sock and you want to get it. This allows you just a little more reach if you can't bend over. Grab bars and non-slip mats in the bathroom are wonderful. They make things a little bit safer. And depending on, again, the surgery you have and your surgeon, you might be recommended to have a back or neck brace. Your surgeon should be talking to you about this in the office, so you should know if you are going to be prescribed a back or neck brace or not. If you have questions on that, again, write those down and give me a call, and I'd be happy to talk with you about that. So before surgery, we set you up with a pre-assessment testing appointment. You come in, you talk to a nurse, they go through all your medicines, your past medical and surgical history. So this lets us see anything that could cause an interaction with your medicines, maybe something in your medical history that we need to know about so that we can optimize and get everything ready before surgery. You also have some different testing, EKG, chest x-ray, some different blood work. All of this is for our anesthesia protocol. It's making sure your body is healthy and ready to go through anesthesia. So really, all of this visit is making sure that your body is healthy and ready for surgery. Now, when you come in, they're going to give you a bottle of this special soap. They might call it CHG, they might call it HibaCleanse. Basically, it's a high-powered antimicrobial wash. It's like our first line of defense, getting your skin nice and clean, ready for surgery. So they'll tell you in your pre-assessment testing appointment that you're going to have a shower the night before surgery and the morning of. You've got to have both of those showers kind of right together like that to get the most benefits. So when you get in the shower, first thing you're going to do is use your regular shampoo, regular conditioner on your hair if you need to wash your hair. Then you want to make sure you use your normal soap on your face and your genital area. Those are sensitive, so you don't want to use the special soap there. After that, though, you're going to use this soap everywhere else. Pay special attention to your neck or your back where you're having surgery, and then your places that tend to sweat, like your armpits, behind your knees, that kind of thing. Once you've got the lather on your skin, let it sit there for about 3 to 5 minutes, and then rinse it off. And after that, nothing else on your skin. So don't climb out of the shower and put on lotion or deodorant or powder. Just leave your skin nice and clean, ready to go for surgery. In preparation for surgery, we recommend you don't have any fingernail or toenail polish. For packing, we want you to pack some loose, comfy clothes and shoes with a back on them. You are going to be working with our therapy team to practice dressing while you're here, especially for those with new restrictions, or maybe you're wearing a brace that you don't normally wear. We want to practice the dressing process with all of those different things. So bring the clothes that you know you're going to be wearing at home. That might be, comfy pajamas and house shoes, but we want to practice the dressing process with you within those restrictions. If you use a CPAP or BiPAP at home, that's something you'll want after surgery. Anesthesia can be kind of hard on your lungs, so that CPAP or BiPAP, especially that night, will be very important. We do have machines here that you can use, but everyone says that they don't really prefer ours. So if you've got one you like at home, I'd bring that one. All right, so let's put some of that together. So you've reached the day before surgery. Of course, you've had your 5 days of shakes already, but we're looking for surgery tomorrow. So day before surgery, you do want to have that first shower. You do want to have clean sheets on your bed, clean pajamas that night, because of course it doesn't make any sense to clean all that bacteria off your skin and then climb into dirty sheets and put it right back on. Do have your first carb loading drink, and do, as much as you're able, try to get a good night's sleep. For your don'ts, remember after your shower, don't use deodorant, lotion, or powder. Morning of surgery. When you wake up, you do want to have your second carb loading drink. You do want to have your second shower. Do leave any valuables at home as much as you're able. Make sure if you take a heart or blood pressure medicine, you do go ahead and take that either with a small sip of water or with your pre-surgery drink. And your either pre-assessment nurse or your doctor's office will make sure they help you identify which medicine that is. And then do make sure you plan to get here on time. For your don'ts, remember, don't use deodorant, lotion, powder, makeup after you've had that second shower. Now, if you want to pack any of those and use them after surgery, that is perfectly fine. Just don't use them beforehand. And then don't have anything to eat or drink that morning except your carb loading drink. All right, so coming into the hospital that morning, you'll check in at the big front desk that you saw whenever you came in for your pre-assessment appointments. They will get you checked in and then up to the second floor. That's where we do our surgeries. The first person you'll meet is your pre-op nurse. They'll get you and your coach back if you want your coach with you during that pre-op time. The nurse will do an assessment, start an IV. They'll give you a gown to change into. We'll get some consent signed. Your anesthesia provider will talk to you about the plan for anesthesia. We typically do general anesthesia, which means you're asleep and intubated throughout the procedure. And then your surgeon's going to come in one last time. Just see if you have any last questions, make sure everyone's on the same page. After all that's done, they'll take you back to the surgery area and your coach will be able to wait there in the surgical waiting room. Your surgeon should go out and speak with them after surgery's done to let them know how everything went. Back in the operating room with you, of course, you'll have your surgeon. If they have a PA who's helping them, that PA will be back with them too. You'll have your anesthesia provider. Now, your anesthesia provider monitors you the entire time that you're asleep. They even start giving you medicine for pain and nausea while you're asleep to kind of help alleviate that when you wake up. You will have a catheter for surgery. Now, I know that's bad news to a lot of people, but the good news is that it goes in after you're asleep and comes out before you wake up most of the time, so most likely you won't ever even know that you had it. You will likely have a drain, of course, again, depending on your type of surgery and your surgeon. The drain may look like a bulb or it may like a big blue disc, but this is something that can help pull that drainage that tends to accumulate in that surgical area. It pulls it out and away from it so that you don't have just a fluid pocket developing there. Now, this is something that you will not have to worry about at home. It is only in the hospital. We will take care of it while you're in the hospital, and we will pull it out before you leave for home. After surgery, they'll take you to the recovery room. This is where you're waking up from anesthesia. You'll have a nurse that is monitoring you very closely while you're down there. We watch for any changes in your vital signs. We also have medicine for pain or nausea that we can give you if you're experiencing any of those. You will be ready to advance when you are awake and alert and you are ready to get up and move. Now, this is for coaches. Your coach may or may not come back with you in the recovery room. After you're awake and alert, ready to get up and move, we're going to move you on to the 6th floor. That's the next place that you're going to go. So if you're awake and alert, ready to go, your coach might be told, hey, we're going up to the 6th floor, meet us up there at room 6, whatever. Sometimes, though, you're awake and alert, ready to go, and we don't have a room available quite yet. We're maybe still cleaning it, or we're still, waiting on one to come available. If that's the case, then your coach might be asked to come in the back and sit with you. So you can let them know they may or may not see you while you're back there. At some point, though, we are going to get you up to the 6th floor. Now, up here on the 6th floor, we have all private rooms. We'll monitor your vital signs continuously for a while when you first get up there, and then we'll unhook you and just come check it every 4 hours or so. We'll do hourly rounds while you're here, and you'll have a call light in your room that you can use if there's anything that you need. You will probably have already had a conversation with your surgeon in the office about how long that you're going to stay. Usually, though, it's 1 to 2 nights, depending on your surgery and how you're doing. While you're here, we will do bedside shift reports. We'll have a whiteboard in your room that's got the name of everyone taking care of you that day. We'll have information about your pain control and what assistance you need when you get up. We also want to provide you with a safe environment. Part of that means you always call for assistance when you need to get up, even if you're feeling great, even if you think you got this. We want to make sure you're safe while you're here, so please always call before you get up. We'll do frequent assessments. Any new medicine you take, we'll make sure you know what it is, why you're taking it, what side effects could come from it. For meals, they're going to bring you a paper that's got the number to the kitchen. You can call the kitchen whenever you're ready to order, and they'll bring your meal up. We will also, as I mentioned before, bring you 10 more of those nutritional shakes so you can get started on those after surgery. Physical and occupational therapy are going to work with you every day that you're here. Now, they're going to be less focused on exercises while you're here and really more focused on all those things you need to do for self-care when you go home. You'll hear more from the therapy team at the end of this class. You will be given an incentive spirometer. That is this machine up here. If you have had surgery before, you have likely used one of these. It's a machine that exercises your lungs, and the idea is to help prevent you from having pneumonia after surgery. Now, this machine is very important, especially if you have COPD, a history of pneumonia, asthma, any kind of issues with your lungs. But this machine is not the best thing you can do to prevent pneumonia. The best prevention is for you to be up out of bed. So that is something that we're going to encourage. When you go home and you're able to move around freely, we would like for you to get up and move every hour that you're awake. Doesn't have to be anything crazy. Maybe you take a trip to the kitchen, a trip to the bathroom. Maybe you just walk in place, but we wanted you to get some movement in at least every hour. While you're here in the hospital, you may not be moving quite as much. So in addition to the therapy that you're going to do, we want you to do at least 2 things for us. Number 1, we want to make sure you eat all of your meals up in your recliner. So don't eat any of your meals in bed. If the kitchen delivers the tray to you, just call your nurse and let them know you need some help getting up in your chair. The other thing we ask is that you don't use the urinal or bedside commode in your room if you have them. We would prefer you walk all the way to the bathroom. Now, I know for most people that's not hard. They would rather go to the bathroom, but for some people I know, bladder has a different idea. Okay, so if you have issues with your bladder and it's urgent, go ahead and use whatever means you need to, but maybe then you take a trip to the bathroom to wash your hands. That way you still get that walk in. So working with therapy, up in the chair for all meals, walking to the bathroom every time you need to go, at least while you're here in the hospital, that should get you up and moving enough to prevent pneumonia. And when you go home, you can do a little bit more moving from there. Depending on what surgery you had and your surgeon, you might be given one of these polar ice machines. So that's this machine here. It looks like an ice chest connected to an ice pack. So it's going to filter this cold water through to the ice pack. So you've got an ice pack that does not start to match room temperature or your body temperature. It's going to stay nice and cold, which will help with swelling and help a whole lot with pain. So for this polar ice machine, we will take care of it while you're here in the hospital. We'll make sure it stays filled with ice. When you go home, we will send this home with you. So what we recommend at home, instead of buying bags and bags of ice to fill your freezer, we recommend freezing 4 water bottles. Those frozen water bottles will fit here in the corners. You put the water, there's a line in there. You'll put the water to the line up on top of the water bottles. But that way, as that ice starts to melt, it melts into the bottle. You pull those bottles out, and you'll have 4 new frozen water bottles in your freezer ready to go. So you'll put the 4 new frozen water bottles in, and you'll put those melted ones back in the freezer. So you can be rotating 4 and 4 frozen water bottles. Now, for you guys who have restrictions on bending and lifting, that trick is going to be especially helpful for you because that means even if you don't have a coach in the home, you can do the switch out of the water bottles yourself, especially if you have this setting maybe on a stool or chair or something that's a little bit elevated. You're not going to be able to lift a bag of ice by yourself, but for water bottles, especially, if you need to switch, carry 2 and 2, that's something that you can handle. So setting that up is going to make it a lot easier for you to do this for yourself and not have to rely on somebody else. While you're here in the hospital, another machine we'll have you hooked up to are these SCDs. Now, you don't have to remember that name. It stands for sequential compression device if you're interested. Really, what we want you to understand is why they're there, what they're used for. They're going to fill with air, so they pump your legs kind of consistently. It's going to feel like a leg massage, but what it's doing is helping keep your blood circulating. After any surgery, including a spinal fusion, you are at a higher risk for developing blood clots, so we want to help prevent that from happening. One of the ways we do that is to make sure your blood continues to circulate. Okay, so we'll have these on you while you're here in the hospital, doing a little more laying around than you would anywhere else. Something simple we'll ask from you is to do ankle pumps. That's just as simple as moving your foot back and forth. So just the act of moving your foot back and forth is enough to keep your blood circulating, and that will help prevent blood clots. So you can do that while you're here at the hospital, while you're at home, sitting in your chair, while you're traveling. Ankle pumps will really help. So let's talk about managing your pain after surgery. Okay, now a lot of you're coming into the surgery because you're in so much pain all the time. So it may not sound great to you to say we do expect a little pain after surgery, but we don't expect it to be crazy. Okay, so let's talk about the type of pain first of all. The pain a lot of people are experiencing before surgery is that nerve pain. So there's a lot of burning, sharp pain associated with it. Now, sometimes when people wake up from surgery, because the surgeon goes in, cleans all that out, opens everything up again, makes it where the nerves have a clear pathway, sometimes that pain is gone as early as when you wake up from surgery. For some people, though, there's a little bit of swelling, some things that still need to heal, so you may not wake up completely free from the nerve pain, but that comes in a week or two after surgery. Now, after surgery, though, you will have the post-surgical pain. So that might feel a little bit different, might be a little more aching. It's the pain that comes from your surgeon having just done surgery all the way to the bone on your back, right? So it's a little bit different than the nerve pain that you've been experiencing. A big thing I want to point out, though, is the pain level that we can expect. So if you look at this pain scale, this is the pain scale that we use with you guys all the time, where we ask you, how would you rate your pain on a scale of 0 to 10 if 10 is the worst? Okay, so we do not want, nor will we expect your pain to be up here all the time. Okay, that is not managed pain for us. After surgery, we want you moving. We want you getting out of bed. When you go home, we want you, every hour that you're awake, getting up and doing some kind of movement. If you're living at a pain of a 9 or 10, you're not going to feel like getting up and doing all that movement. However, we usually don't tell people to expect that they're going to get all the way to 0 right after surgery. Most of the time, somewhere between a 3 or 4, maybe up to 5 is a pretty good expectation and goal for pain control after surgery. And we're going to do several things to help get it there. So one of the things we'll have some medications. Depending on your surgeon and depending on your history and background, you can expect maybe, some of a different medicine. So your surgeon might prescribe a muscle relaxer to kind of help ease those muscles around where they've done surgery. They may prescribe a medicine for your nerves. They might prescribe an anti-inflammatory medicine. Most of the time, they will definitely prescribe something a little stronger, something that has an opioid in it, okay, that attacks pain in a little stronger manner than some of the others. Now, most of those medicines prescribed that have an opioid in them are ordered as needed. So here in the hospital, what that means for you is you have to ask for them. They don't just come on a schedule. Make sure you're keeping an open conversation with your nurse about what your pain level is so they know when to bring you another pain pill. Other things you can do to help with pain, repositioning, and movement are important. Changing positions. Ice is going to be important, so you might be given the polar ice machine, or you might, when you get home, use an ice pack. A lot of people find an ice pack is helpful. You can use, if you have the blue gel packs, or maybe you just like a bag of peas or something, that's great. Whatever ice pack it is you're using, always make sure you have something between the ice pack and your skin as a buffer. Something like a small towel will work. To all of that, you might add things for distraction, listening to music, watching TV, meditation, deep breathing exercises. These maybe won't control your pain by themselves, but they're going to help make your pain pill, make your ice work a little bit stronger. Some other medications you can expect while you're here. We are going to give you an antibiotic through your IV as a prevention measure. You will have medicines ordered for nausea. So if you are feeling sick after surgery, let your nurse know. They will have medicine they can give you. We will also likely start you on a medicine to help prevent constipation. That might be a stool softener. It might be something like Miralax. But after surgery, again, with those pain pills, they do tend to cause constipation. So we want to make sure we hopefully help prevent that before it happens. When you go home, you need to be paying attention to this. Pay attention to how often you're having bowel movements. You might have some Miralax available at home ready to go. And, it might be a good idea to take that at least until if you notice soft stools, you might stop taking it. But you do want to make sure that you're having bowel movements as long as you're taking that pain medicine. If you've gone 3 days without having a bowel movement, you might give your primary doctor or your surgeon a call, let them know what's going on. That way they can suggest something different for you to help make sure we keep your bowels moving. Now, like I said, most likely you're going to be here for a day or two. So what are we looking at that says that you're ready to go home and continue your care at home? Well, number one, we want to make sure you can understand and operate within all your precautions. There's a lot of things that you have to do to be safe around your home, and we want to make sure you can do all the things you need to do within your precautions. We want to make sure you can get in and out of bed, in and out of a chair, on and off the toilet, dress yourself, all those things without assistance. We want to make sure you're safe walking and that your drainage output is low enough that your drain can be removed. Once you check all these boxes, we will get you out of here and get you home. When you go home, we're going to be working on taking care of your incision. That's going to look different depending on your surgeon, and you will be given your surgeon's specific care instructions for what you need to do. So if you're doing dressing changes, you want to make sure, depending on, if it's the front of your neck or your back, you might have to have someone help you with that. When you're doing dressing changes, though, the big thing to keep in mind is you want to keep your hands clean. So hand sanitizer before you change your dressing, hand sanitizer again before you put the new one on. Some people ask me about using gloves. Gloves are great, but gloves are not a replacement for cleaning your hands. So I would much rather you use very clean hands and no gloves than to just put gloves on over dirty hands. But if you like the gloves, that's great. I encourage that. Just sanitize your hands before you put them on. You also want to think about, if you're doing dressing changes, do your shower before you do the dressing change. That way, if any water happened to sneak in, sometimes that happens, that way you're changing it immediately afterwards. So if your dressing is off, that's fine too. You'll want to keep your incision clean and dry. So whether you have to pat it dry, but after you remove the old dressing, or whether it's, you've just stepped out of the shower, you want to pat dry with a clean, dry towel after you're washing. If your dressing is off, you do want to make sure that spot stays clean, but it doesn't need any kind of harsh cleaning, and you definitely don't want to scrub where that incision is because you don't want to pull off any of the scabs that might be there. So just a gentle cleaning with a gentle cleanser, something even like a baby shampoo could be fine. But for sure, make sure you follow your surgeon's specific orders for your dressing care. Things you can do to reduce your risk of infection: you want to not smoke or limit your smoke like we talked about. You want to watch your blood sugar levels. If you're diabetic, you might have found that stress can make you see numbers that are higher than you're used to. So if you start seeing that, if when you're checking your blood sugar, it's higher than numbers than you're used to seeing, you might give your doctor a call, the one who's monitoring your blood sugar, and just let them know, hey, here's the numbers that I'm seeing after surgery. Do you want to make any adjustments to my medications while I'm healing up? Because making sure those blood sugar levels are under control really goes a long way in preventing infection. You want to take any medicines as ordered, and very importantly, you want to keep your hands clean. So whether you're touching your incision or not, let me say, whether you are mindfully touching your incision or not, our hands are going to go different places, so keep that in mind. But you want to make sure your hands are clean because that helps prevent spreading bacteria around. Also, you just want to think clean. Anything next to your incision needs to be clean. So always make sure you start the day with clean clothes, you've got clean pajamas, you have clean bed sheets. You want to make sure that if you have pets in the home, they're not so clean, so they don't need to be rubbing next to your incision. If you touch your pet, just please wash your hands immediately after petting them. Don't maybe sit in the place that their pet normally sits in. Just put yourself in a clean environment. So everything, you need to think clean. Everything around your incision needs to be clean. I also want you to know the signs of infection, when to call your surgeon. So if you notice a fever of 101.5 or higher, if there's a sudden increase in pain, swelling, or redness there near your incision, or if the drainage, if all of a sudden there is a lot more of it, or if it had stopped and starts back all of a sudden, or if it changes color or has a smell, any of those can be signs of infection. So if you notice any of that, call your doctor. And along that line, if you have any questions at all or any concerns, please don't be afraid to reach out, call your doctor's office. Feel free to reach out to me if you need to, because we know how these things go. We don't ever decide that something is definitely an issue until it is 5 o'clock on a Friday evening. So if in doubt, if on the fence, don't hesitate to call. Now, after surgery, really the big thing you're going to be doing to heal up is doing some gentle walking, some gentle movements. Depending on your surgeon, depending on where you are, you may or may not have any kind of actual physical therapy described after surgery, but you want to make sure you're getting that movement in because that helps with healing. Also, though, you have to add in some rest. So I tell everyone you've got to have a good balance between rest and movement when you go home. You can't go home and just sit around and think things are going to be fine. They won't. You got to add that movement in there to be healthy. But you also can't go home and just pretend you didn't just have surgery and do all of your regular chores and hobbies and things. You've got to add some rest in there too. Some questions people might have as they're healing up. When am I going to get to drive again? Your surgeon will approve that. First off, we want to make sure that you are not taking the pain pills, because those pain pills can make you sleepy and we don't want you driving like that. We also want to make sure that you're able to drive safely within your restrictions. So sometimes your surgeon might clear you to drive at that first doctor's appointment, but that's a conversation you'll have with him. What can you expect about going back to work? Again, your surgeon has to approve you. A lot of it, though, depends on what kind of job you work at. If you have a job that you can sit down when you need to, you can move when you need to, you can kind of take it easy a little bit as you go back, he might get you back a little sooner than if you have a job that's got very strict requirements. So just have a conversation about that. And then how about lifting? If you have a restriction on lifting greater than 10 pounds, how long is that going to be? Probably somewhere around 6 to 8 weeks. And again, remember, you want to give your body plenty of time to heal. You want to maintain those restrictions as long as it's required. That way, when it's time and they're lifted, you are ready to go back and you're not messing anything up.
I'm Michelle, and I'm a physical therapist.
And I'm Jeannie. I'm with occupational therapy here at TMC.
And we will be seeing you after your fusion surgeries. We will start pretty quickly after you have surgery, usually within 2 to 3 hours. We're going to get you up out of bed and get you moving around. That could be in PACU recovery if you need to get up there, or it could be as soon as you come to the 6th floor. We will be working with you directly off the stretcher. We're going to go over some of your precautions. We're going to have the main precautions as no BLTs. That's no bending, no lifting, or no twisting.
So when we refer to no bending, it's going to be no excessive bending. You're not going to bend over, reach out, pick something up off the floor, or when you're dressing, we're not going to have you bending over and picking up your socks and shoes. You're going to actually have to bring your leg up to you. If you have any problems with your hips or your knees, that may restrict you. So we'll kind of go over some of the adaptive equipment that might help you be able to dress without bending. And that would be like a reacher. Many of you know them by grabbers, but it just has a trigger, and it will hold your clothes down so that you can bend over. You can drop them down to your floor or your foot and get them on without having to bend over. There's also a sock aid that some of you may benefit from. We'll go over all this equipment with you. Okay.
The second precaution is no lifting. You cannot lift over 10 pounds. That can be a gallon of milk, a 6-pack of Coke, about that weight. You're not going to be allowed to lift anything that is heavier than that. And then no twisting. So you can't do this motion. You want to keep your back nice and straight. Anything like a seat belt You're going to have to grab it with the hand closest to the seatbelt, bring it to the other.
Laundry in the kitchen, getting things in and out of the refrigerator is going to be a lot of times that you're going to be twisting. So the reach or some of that kind of equipment will come in handy for those kind of things too. But we'll be teaching you the log rolling technique to avoid the twisting the most. And that's the first thing we'll teach you when we see you in recovery or off of the stretcher.
You're going to want to get everything to countertop level. That will help prevent you from bending over. Family, if they're in the house, you're going to want to ask them to get things out of the bottom freezer if you have a bottom freezer, or under the cabinets if you haven't already done that. If you're a cervical fusion, you're allowed to perform neck range of motion. He just doesn't want you to force it to end range, but he wants you moving. He wants you turning your head and looking side to side and up and down so that you don't develop tightness and increase pain.
There are 2 exercises that most of the physicians will want you to do, or surgeons will want you to do. Those are your shoulder rolls, forwards and backwards, and then your shoulder retraction, so kind of squeezing your shoulder blades together. Those kind of help relax some of your neck muscles after surgery.
We're going to have you walking mainly as your main exercise, not cardiac walking, just leisurely walking around your house, up and down the driveway on level surfaces. You may have an ice machine called a polar ice. We will help you keep that filled with ice. If it's feeling warm, we want you telling your nurses, your aides, your therapists, so that we can keep it cold. That helps reduce pain and swelling. So we want you using the cold packs or the polar ice machine as much as you can.
We do not want you using heat around that incision area because that only increases inflammation and swelling.
You will not be able to drive for 2 weeks, so you're going to need someone to take you to your follow-up doctor's appointment. It's usually 10 to 14 days, and you're not going to want to go on any excessive long road trips following surgery unless you discuss that with your physician.
Lastly, you'll be able to shower daily once you get home. While you're here, you'll possibly have a drain and a dressing over there until the surgeon replaces that and removes your drain. He doesn't want you taking a shower until then. He just doesn't want you submerging that incision into anything like a hot tub, bathtub, pool, anything like that until that incision is completely healed. Some physicians want you to change the dressing daily, and some can say you can leave the dressing off after day 2.
We'll also go over some stretches that you're allowed to do following surgery and give you a handout so that you know how to do the stretches and you feel comfortable doing them before you go home. So only the walking, the ankle pumps, and the stretches are the allowed exercises until you return to your follow-up and your physician progresses to do more. Some of the fusion patients will be placed in a brace following surgery from anywhere from 6 to 12 weeks. If your doctor orders a brace, we will teach you how to use that, when to use that. Usually it is when you are out of bed. You can put the brace on while sitting edge of bed, and then use it while you're up and around, and then before you go back to bed, you must take the brace off. We don't want you developing any sores from sleeping in your brace.
And we will fit the brace to you when we first see you. We'll make sure it fits you to the right size and show you how to adjust it as well. For the back braces, we always suggest, or even the cervical braces, we suggest that you step into your shower or your bathtub area before you take off the brace so that you're secure before you take it off. Shower chairs are another option, whether you have a bathtub or a shower. We recommend you getting something to sit on. It will help with preventing you from having to stand one-legged and wash and take the chance of falling. So something you can sit on, and then you can bring your legs up to you to wash.